Greetings and welcome to a special video edition of the CSA's podcast series, Vital Times. This will be published in parallel on both the CSA's YouTube channel as well as its regular Buzzsprout podcast platform. The reason, October 1st is Latinx Physician Day, and especially in California, this is a focus for celebration and amplification. We are joined today by a group of Latinx anesthesiologists who represent the spectrum of anesthesiology practice, academia, Kaiser, and private practice. Dr. Viviana Ruiz Barros grew up in Colombia and Los Angeles and is a board-certified pediatric anesthesiologist at Shriners Children's Hospital of Northern California in Sacramento. Dr. Antonio Hernandez Conti is the president of the California Society of Anesthesiologists. He is a clinical professor at the Kaiser Permanente School of Medicine and partner with the Southern California Permanente Medical Group, where he practices cardiac anesthesiology. Dr. Jennifer Lucero serves as the Associate Dean of Admissions at David Geffen School of Medicine, UCLA, and is the Vice Chair of Justice, Equity, Diversity, and Inclusion in the Department of Anesthesia. Her clinical specialty is in obstetric anesthesia. Welcome, everybody. And I wanted to make sure that I sort of set up the premise for this. Did everybody know that only 6% of physicians are Latinx in the United States? Yes. Our country actually is made of 19% Latinx population. California itself has an even higher Latinx population, reaching 39%, with further increases projected to 50% by the year 2050. There are significant healthcare barriers, inequalities, and poor outcomes, medically speaking, in the subpopulation. So there's a lot of work to be done. And I think this is a perfect time to discuss all of this. So the very first question I wanted to pose was this journey worth it? And let's start with Viviana.
Absolutely. I've had the pleasure of having younger students reach out to me as they're deciding what kind of specialty. I'm talking about medical students, and they're trying to decide where to go next, what kind of residency they do. And actually, it's uplifting for me when I hear myself talk to them, because I do absolutely love what I do. I am thrilled to work with the patients that I work. I get to help the most needy children in our area. And I bring a lot of happiness to them and their family. And I'm there at the moment of very difficult times in their lives. I am very honest with the people that are trying to find out what anesthesia is like. That there are some challenges. There are many challenges in our specialty, and it's not one where you kind of have like a 9-to-5 job like you'll have in other subspecialties. But I do think it was absolutely worth it. And if I had to pick anesthesia, or if I had to go through medicine again, I would 100% pick anesthesia. Yes.
Good to know. Jennifer, Antonio, did you want to add to that?
Sure. I'd certainly like to amplify that emphatically. Yes, I would do it over again. It's certainly been a big journey. And I think sometimes we forget where we started and all of the obstacles and barriers that we faced. And just last Friday, I spent the evening with a group of middle schoolers from Virgil Middle School here in Los Angeles. It's part of one of the schools that Kaiser Permanente works with as part of the Hippocrates Circle program. And, we got to spend time, like 2 hours just as our first initial meeting. It's a mentorship program. They learn about medicine. They learn about financial aid, how to get into colleges, how to set themselves up for success. But it's also a way for their parents to come and sort of speak to us as well and get guidance. And, it's really, really forgotten, I think, where I came from and where I had started, when I was 13 or 14 years old, just being interested in science and math. And so, it's really, really, I think, nice to pay it forward, but I think it's nice to reflect on how far, we've all come, but I think more importantly, how much more we still have to do.
I'm happy to jump in and just add the perspective of was this worth it from the specialty of anesthesia? I came into anesthesia having trained in OBGYN and practiced for 2 years before I changed specialties. And I think for me, that journey and looking at what I could have done if I decided not to practice clinically versus, going back and doing another residency, it was so important for me to think back about why I chose medicine, and my community was really a priority. And so I went back and did anesthesia in it. I think for me, it was the experience I had working with the anesthesiologists on the labor floor that really made me think strongly about what we do as anesthesiologists, how we care for patients. We are, the acute physicians that when there's a crisis, as an OBGYN, I always looked to the anesthesiologist to help us. And so I felt it was a very rewarding specialty. And so when I came back to do another residency, I was really all in and excited to continue and do that work. And I had such great mentors and role models that I could look to when I changed and decided to do anesthesia. So it's very rewarding, and I'm really grateful.
That's really inspiring. Jennifer, I wanted to follow up with you about this since you've had the experience of, reaching out and communicating in as two different types of specialists. Mm-hmm. Do you feel like communication is different, and how is it different? Do you feel like you have more impact in one versus the other when you're talking to the Latinx patient population?
Yeah, I mean, I think I sort of draw on my both experiences in OBGYN and in anesthesia. When I was training, I trained at UCSF in OBGYN and in anesthesia. And when I was an OB, my clinic was at San Francisco General. And so I had a large Latina population that I cared for, and really understanding kind of the issues. They really saw that I, as a physician that was a Chicana, they understood I could relate to the issues and the concerns that they had. In addition, I think, there were unique situations where there were situations that were either cultural or we had a large undocumented population, and being able to feel like they could trust and see me as a member of their community, I was able to do more and get more information and trust from them. That actually then allowed me on the other side to, as an anesthesiologist, really relate to them as they were in any cesarean deliveries. If they were going through different procedures, I could connect with them, and I understood the sort of other side of what was happening, and I could communicate to them. Because when you're doing a C-section, one of the most impactful things I realized when I was an anesthesiologist on the other side of the drape, so to speak, was that you have this intense relationship with your patient. And in the past, when I was an OB, I was just focused on the surgery, and there was this disconnect. But when I was on the other side as the OB anesthesiologist, I was able to connect with them. And really, as I knew what was happening, I could advise and reassure them. And really, I was that support person for them. And I think that being able to have that trust and know that I was there to look out after them was really important. And being part of the community, it actually for them was really important because it's about a connection and a relationship with our patients.
That's a very powerful connection. You're so right. And I wanted to circle back to Viviana. So you were talking about, sort of inspiring, a even younger generation now. People talk about how you can't be what you don't see. So, you're out there representing. Do you sense that at all when you're doing your outreach?
Yeah. So I was very fortunate to have been part of starting a chapter of Project Lead the Way at UC Davis in my prior 2 years there. And we got sponsorship from CSA. So this is a program that was really important to us to get started and going. And we were able to go to 3 high schools in the local Sacramento region. And many of these children, I could see the difference in the different high schools, depending on where they were located, the resources, the kind of preparation that the children had. But at the end of the day, when we went through teaching them about cardiopulmonary physiology. We even taught them about intubating. We brought mannequins. We told them about what it is to be an anesthesiologist, what our work do, what our pathways to medicine were. And I think one of the most rewarding parts of doing this was at the end when the guys or the girls will come up to us and they would say, I just never saw somebody in the medical field, or this is my first time talking to a Latino physician. I feel inspired, and they will send us thank you notes that were very specific about how impactful it was for them to see somebody that looked like them. And I think most of us can identify with a moment where seeing somebody who had a similar background or a similar story to us helped us feel empowered, or helped us feel like maybe I can do that too. These folks overcame these challenges. Maybe I can do that too. And so, yes, the feedback does come very frequently, but also in just seeing, I have a large number of Latinos being in the pediatric field, a lot of Latino and Hispanic background patients. And for them to see somebody that looked like them, there's just a different connection that forms. And I do feel that very, very frequently. So I'm happy that we can bring that to the younger generations.
Yeah, that's great. Okay, I'm going to go on to the next question. I have so many questions for you guys. So we're talking about being Latinx. How has being Latinx impacted your career choices and decisions? Because there's so many different factors for everybody when they're thinking about careers. So I'm just kind of curious about how that one particular detail, we're all made of different things, but how is that one, glaring detail important in the way you've evolved? And let's switch things up and start with Antonio.
Sure. I think, first of all, it's a very good question because a lot of times, as we're arriving into medical school, somehow we'll get some sort of messaging from either other physicians or, mentors, and they'll say, because you're Latinx and Hispanic, you really should be a primary care physician. And you really should go and serve the community and kind of open a clinic or work in a, underprivileged area and, kind of work on the front lines. And, it's interesting because it's sort of like, well, why would you want to limit my choices? That may not be what I'm necessarily interested in. And I think, our presence is needed everywhere, whether it's primary care, family practice, or any of the surgical and perioperative sectors. Our presence is lacking basically everywhere. So I think that, there is a bit of bias when Latinx, Hispanic medical students are in their training and trying to think about their career choices. They're sort of, kind of skewed towards a particular direction. And I think it's really important for everybody to be true to themselves and say, no, I'm really interested in surgery, or I'm really interested in OBGYN, or I'm really interested in anesthesiology because, it's a combination of physiology and pharmacology and doing procedures. But I think the most important thing is that we need to be everywhere because our presence allows research to be done so that we can sort of address healthcare disparities. It allows us to be, quote, the primary caregivers in the perioperative sector. When I see my patients in the cardiac anesthesia clinic, and there's a large percentage of people who are Hispanic who need open heart surgery, unfortunately. And they'll often say to me, you're the very first Latino Hispanic person I've met in all these years, certainly in the specialty areas, prior to getting to their day of surgery. And it's kind of eye-opening, not surprising, but, it is kind of eye-opening. And, I sort of reiterate, well, we're here and we're here to take care of you. And, I think it's really important that we sort of stamp out that bias, that selection bias or judgment that goes into it. And, I think we'll talk a little bit more about that later, how that continues later in our careers as well. But perhaps Jennifer can speak on that from her perspective.
Yeah, thanks, Antonio. I think it is when I went into medical school, I, you know, thought to myself, I'm going to be a primary care doctor because that's, that was for me, like looking at my family, they're from South Los Angeles, and that was really sort of a high need area and under resourced. But when I went to medical school with that idea that I was going to be a primary care doctor, I thought, oh, I can't be a surgeon. I can't be, any specialty. I also didn't even know what anesthesiology. I didn't know there was a specialty that was anesthesia. So I was very limited in sort of what my perspective was. And I remember looking at this book it was one of these, books where they talk about the history of medicine. And I was a young kid, and there was this picture. It was actually a picture of a depiction of the ether dome and the first use of anesthesia. And I just looked at that and I thought, wow, I want to be a doctor. And I was so young, and I thought, that's not something I can do. That's not what that's not what we do. None of my family members went to college. Some didn't graduate high school. And so for me, it was so far away. And I thought, I'm just going to go to college and I hope I could be a doctor. But there were so many barriers, and the system, I think, Viviana talking about the education system, really pushing back against that and not seeing me in that role. One of the things that I looked at in that picture, and I bring this picture up, I actually put it up on our second look day when we bring everybody that has gotten into medical school back to, recruit them to come to DGSOM. I show that picture. And I remember saying, do you know where this is? And they all look at it. And I said, what is one thing that you notice? What is one thing that's glaring? And they say it's all white men. And I think, and I have them look around because we have an incredibly diverse medical school. And I said, you all are changing the way we care for and practice medicine, because we're a population that is very diverse, and you're caring for your communities. And I remember looking at that picture and thinking that was so far away. It didn't occur to me until years later when I was doing research at Brigham and Women's, and I went to Mass General, that was the ether dome was there. And, fast forward, as much as I ended up doing all this training at OBGYN, I thought, that it was telling that I was so inspired by that picture that I ended up becoming an anesthesiologist, because that was the depiction of the first delivery of anesthesia. So I like to think about how, those little symbols change us and motivate us. And I think if I looked at what is going to be the next generation of anesthesiologists, we could all be sitting around in that ether dome, but it's going to be a very different view. There will be very different people standing there around the table. And I think that's really important that, we think about how much we've changed medicine and how much more we have to do in medicine. But yeah, I agree. There's a lot of things that sort of push us and kind of, tell us that there are barriers that we have to overcome.
That's so inspiring. Thank you both for talking about your origin stories. Viviana, did you want to answer that?
I have to say that I remember when I was doing clinical research at San Francisco General, and I was working with the pregnant population there. So Jennifer, talking about your time there brought me back. And I remember being in a period where I knew that going to medicine was going to be really hard work, both from a time perspective, financial commitment. And I kept delaying the decision to go because I felt like I really wanted to have a very powerful reason to do it. And when I worked with those women, most of whom were Latino women, I felt this so strong connection with them, and hearing their stories and hearing about all the work they had to do to be able to come to our study and participate. Some of them work in the fields, and some of them work long hours in the fields pregnant. And I remember connecting to that and feeling like I'm in a position where I can actually help this population. And I'm coming from a position of power now, being an educated Latina woman. And for me, that was critical, because if I felt like I was gonna make a sacrifice in terms of my time and my effort and the finances, I needed to have a very strong connection to the people I was helping. And the connection really started there. So having that empowered me and pushed me to do it. Now I came around and I decided to go into pediatric anesthesia, which when I started anesthesia, I never thought I would go into pediatrics. I felt I was going to stay with the adults, but something clicked. And now I would say, to what Antonio was saying, how we felt like we needed to go into very specific areas of primary care in order to make an impact. Being on the other side, where I get to have such a strong impact on my patients on the day to day, I agree. We are needed everywhere. And to have somebody that looks like us and that speaks the language fluently and that can connect with these families the way we do, it's not only gratifying for us, but it is for our colleagues, for our nurses, for the people that work with us. The number of times that I have been thanked for by my nurses and by my colleagues for being able to bridge that gap, I cannot count on my hands anymore. So yeah, what we do has deep impact, and it goes beyond the clinic. I think everywhere we are making an important and significant impact, but we have to allow us to explore what our strengths are and what we're good at so that we can better serve our population.
Thank you. That is so well put. I'm so inspired by this, and I really want to take this a little bit further. And I want to be careful, because I really want to make sure that I phrase this question clearly. What I want to explore is that fine line between feeling like you have to represent almost, and then on the other hand, being true to yourself. So, do you feel like it's weird to have your career need to have a greater meaning? What if you just felt like doing something because that's what you like? Like, what if people say, well, for example, I just read an article about how we as anesthesiologists need to think about having greater numbers in like rural settings. Well, okay, but what if somebody doesn't want to be in the rural area? So that's kind of my question. Like, yeah, maybe there are certain things that we are stereotypically supposed to do, but then there's also just, me or you as individuals. So I would like to hear more about whether that push-pull has, occurred in your careers and how you've gone through it. So let's start with Antonio.
Well, I think it's a really good question. But with anything, it's sort of, we're dealing with the law of supply, right? And so when you're already at only 6% of the total number of physicians in the United States, everywhere we go is kind of like a rural area. I mean, there are no Hispanics. There are very few Hispanics in academia. There's very few Hispanics in the perioperative sectors. There's very few Latinas in primary care. I mean, so basically anywhere we go, it's kind of a dearth of Latina physicians. So I think we just go wherever our calling takes us, and we know that we're going to make an impact. In terms of the bigger picture, does our career or, does our existence have to have meaning? I think, every time I interface with a patient and I hold their hand and I speak to them in Spanish and I can relate to their, background and kind of the circumstances that brought them to being an open heart surgery patient, I'm making an impact that very few other people can. But then on the other hand, I use my other roles, certainly in the CSA leadership and certainly in the Kaiser Permanente EID leadership, to sort of impact health policy, to impact, how we can address, systemic barriers to care and, inaccessibility to care. And so, I think it's a balancing act. And I think as an anesthesiologist, we're very, very privileged to be able to work in a lot of different realms, and we can literally, kind of switch gears constantly. But I think at the end of the day, where I find the most amount of, I think, sort of pure joy is just when I'm taking care of my patients and I'm able to relate to them. And it's just, for me, that's what it's all about. Viviana, how about you?
I it's interesting. I've had this conversation with a friend who it's not a member of a minority group, and we talked about different experiences we had growing up, and or what we've been told about our impact as anesthesiologists. And this friend would say, I'm from Iowa, and nobody tells me I need to go back to Iowa to practice. It's just not something that's ever been told to me, right? So there are specific groups that are, in our case, are being told, well, you need to go back to this community where you came from, and you have to serve this particular population. So I never thought about it too much until I heard it from this person. It worded in that sense, like, yeah, what does that mean for us? And I think it goes back to the question of feeling like you have to be a part of a certain part of medicine in order to have an impact, and otherwise you're not. And when I remember choosing anesthesiology, feeling a little guilty about it because I was not doing one of the core primary care primary care specialties that I had been told were the ones that had the highest need. And so I almost felt like a bit that I needed to explain myself why I was making that choice. So I think it's a really it's a thought-provoking question for me. I do think that we as a minority group may get boxed into certain types of specialties or locations, and I say, like Antonio has said, we're needed everywhere, and we're going to have an impact everywhere. We're not at a point where there's a lot of us flooding the field, and now we have to say, okay, no, now more of you need to go there. Like, we're needed everywhere.
Very true. Jennifer?
Yeah, I think a lot about rural providers and in the work that I do with admissions, and we know that when we think about communities that we're serving in California, it's a large state, and we have a lot of areas that we need to provide care. I would say, we have communities within urban areas that are underserved and under-resourced, and there's communities in rural areas that are underserved and under-resourced. The one thing that we do know is that if you look at the data, individuals who come from particular communities tend to go back and serve those communities. So I think, there's the reason why we have various, at the UC system, they have different prime programs. And so there's an SJV prime, which is the San Joaquin Valley prime. We have, different prime, Davis and San Diego. And we have our own prime LA, which is prime leadership and advocacy programs. They have benefited by really looking at, they either have a group or community or an area. And so I think about, if someone is from a rural community, more than likely when they're done, they're going to they have family, they have a community there. They tend to be the ones that are going to go back and serve that community. We're not saying, you have to go back there or do that, but we know that generally if you're from a particular community, there is this sense of going back, and we've seen it, and that's been shown. So I think, when I'm looking at what are areas and communities that we need to serve, obviously rural areas. And what we do then is we continue to support the students as their students in for pathway programs. So I oversee the pathway and outreach office at DGSOM. And so we have different programs where we do pathway programs in the summer enrichment programs, and we pay attention to those rural areas. And so we reach out to the Humboldt County area, which is a very rural area with limited physicians. So we're bringing in students that are at Cal Poly, Humboldt, that, really don't, they come to our program in the summer, and we do this academic enrichment. We put them together with our faculty and do longitudinal mentorship, and we bring them in and show them, okay, these are the things, these are the skills. They get excited. They have a peer group, and we continue to mentor them. And we do the same. We're building out in the Riverside area and San Bernardino areas, and so really it's the long game. And I think when we think about, what do they end up doing? I'm happy to see them go into medical school, and whatever specialty they decide they love and they're passionate about. To me, they're going to go back to whatever community that they're from, and we need it. We need it in those communities. And so I think I just think looking at it from the perspective of for particular areas, we need anesthesiologists, we need surgeons, we need primary care doctors, and whatever the student is passionate about, let them follow that and have them, go and go back to their community. And oftentimes that's really, they have been impacted by what they've seen in their communities, and they want to make a difference. That's their why medicine. And that's, to me, the most important thing.
I love that. The strategy is get the people from those under-resourced areas, in a higher proportion of them will go back. Mm-hmm. And they'll take that training and those skills back. So I love that. I'm going to move on to the next question. I wanted to know if any of you would have done anything differently now that, you've made it.
People ask me this all the time because I've done 2 residencies.
Oh, okay.
So they always say, if you had to do it over again, what would you, knowing what you know now? And I think it's an interesting question, because I think I have such a unique and full perspective of obstetric anesthesia that, as much as it's was so painful to do 2 residencies, I think I would still, now that I'm on the other side, I would still do it again. And I had such great training and such great mentors. My mentor, who I still talk to and have dinner with, and need to text him and have dinner with him because it's been a while, is Mark Rosen. He was just a phenomenal mentor to me. And so he got to meet me and watch me grow up as an OBGYN on labor and delivery. And then I came back and I got to be an anesthesia resident, and he watched me grow and then do my fellowship with him. So I would do it again. I've had a great experience and a great life and a great journey. So
that's cool. Actually, I'm going to add a second part. So the other two, answer both if you could. What would you say to your younger self? And we'll have Jennifer answer that one as well.
Should I
Go ahead,
answer
Jennifer.
now?
Yeah.
Okay. What would I tell my younger self?
Yeah.
I would say don't get fixated on time. I think I was really obsessed with. I started. I matriculated when I was 27 because I did a whole graduate degree before I went to med school, and I got so obsessed with time and, I've got to do something. I can't do this because it's going to take too much time, or I can't, if I do this research or whatnot. And in the end, time didn't matter. I had to do what I was passionate about. Just stay doing what I was passionate about and follow that your passions. That's what I would have told my younger self.
Perfect. Viviana, what about you?
The part about what would I tell my younger self?
Well, both. What would you have done differently? And what would you tell your younger self?
I would not have done anything differently, because I do feel that the different stages were critical for me to arrive at my destination. sometimes I would question myself. Should I have done that research for 2.5 years or 3 years? Should I, which put me 3 years behind that timeline. And sometimes it's easy to get and fall into the trap that if I had done this and then not done that, then I would be this many years earlier into my had started my career as an attending earlier. But now, when I really stop and think about it, all those things were critical for me to be the person that I needed to be, and to have the maturity that I needed. And so I wouldn't have done anything differently. I would have chosen anesthesia again over and over and over. But what I would tell myself would be to enjoy the process more, as far as being less anxious about what my next step is going to be, and is it going to be the perfect choice? Where am I going to train? Is it the perfect program? Are the perfect people? I already knew when I interviewed at OHSU that was the perfect program for me, that those were my people for that moment of my life. And yet I circled around, well, should it be this one? Should it be that one? So just giving myself credit, because I already knew in my heart where I needed to go. And if I had just done that more frequently, then I would have less agony over, trying to bring everybody together to have me, to help me decide. Well, I already knew, and I still went with my gut feeling. So enjoying more the process, because it all turned out great. I was where I needed to be. I met wonderful people all along the way. I trained at different places. I went to med school at UC Davis. I went to OHSU for residency. Then I went to Stanford for fellowship. Then I went to UC Davis to work for a couple of years. Now I'm at Shriners, and I love that I did that, because I got to meet so many people and build so many relationships. So just enjoy the process.
Bravo. Antonio?
Yeah, I think for me, I definitely don't have any regrets about my path. But certainly, in the last, I think, decade, I've become a bit of an advocate, and maybe some people might call me a bit of an activist. And I think it was always there, kind of hiding, latent. But I think in my struggle to sort of, be the good student, be the good resident, be the good Hispanic, so to speak, who's not causing waves or causing problems, and just sort of needs to be grateful for being there. I think I would have probably, liked to have been a little bit more of a rebel, spoken up a little more, and challenged the status quo. And I think one of the ways to go about it is to kind of arm yourself with the tools that you need, maybe getting a master's in health policy, or, diplomacy, or, economics, and politics, those types of toolkits that most physicians don't typically have, that maybe our legal counterparts do, but they tend to be very good activists and advocates, and they are able to legislate change. And it was kind of always there lurking, but I didn't really kind of know it. So I think if I were to tell young people is the same thing that Viviana sort of mentioned, is don't be in such a rush to get to the destination, because the whole fun is the journey. And, if you spend another 2 years getting a master's, or going to do like an internship in Washington, D.C., or, just anything that sort of takes you in a different direction, I think is all really wonderful. But no regrets, but certainly, I think it's important sometimes to raise your hand and not always ask why, but I think the bigger question is, well, why not? And it's kind of like, and why only 6%? I entered medical school in 1990. It's like 40 years later, and it's still 6%. And so it's not just why, it's, well, why not? Why haven't we changed? Why hasn't it changed? And I think, I'm doing that now. As I meet with legislative groups and caucus, I ask those questions. What are you going to do? What are you going to do for us? So that's my take.
Awesome. That's great. Thank you all for those thoughts, and completely agree with you guys. It's about the process. Talking about the younger generation of physicians coming up, what do you wish for the upcoming generations of aspiring Latinx physicians? if you had what do they call that? Like a magic lamp or whatever, like you can make things happen. Yes. What are you going to make happen? Let's start with you, Viviana.
I wish for them to see a lot more of us, and I think this is what the bottom of what we're trying to get at here is. It's not enough. We don't have enough, and it's not only enough in the numbers, but in the places that we need to be. Right? It's not only being 6% in the being the workhorse, so to speak, but also that we're sitting at the tables where the decisions are being made. And I'm really thrilled to see Antonio in the position that you are, where you can influence and you can not only represent, but also ask these important questions of, yes, we know it's a problem. It's been a problem since, the 1990s, but what are we going to do differently? And so I think having things like, again, Project Lead the Way, outreach programs, putting our money where our mouth is really important. And all those things are going to help. But also, how are we going to ensure that we're retaining those stars or those rising stars in the positions that we want them to be? Because what happens is when we're sitting in this, say, whether it's academia or we're in a position of influence, sometimes there's this feeling that we have to do it all for the DEI initiatives. You are the DEI person, but you're also have these other things on your plate in order to advance your career. And then, so you start getting buried into this thing, some of which are recognized as important and others which take a lot of time but are not. So how are we going to say, this is important work. We are going to support it, not only by saying, hey, we have this program in our school or in our hospital, but actually giving that person the time, the money, the preparation, the training, so that we can make the impact that we want, so that we can attract the people that we want. And importantly, that we can keep them in those positions where we can continue to make the influence that we need.
Great point. Thank you. Antonio and Jennifer?
I'll jump in. Well, I think first of all, as I start to reflect and look at the younger generation, and certainly the world has changed with social media, the way we communicate with one another. But I think there's a really important thing that we need to sort of pass down to the younger generation is that it does really help. It is really important to sort of arrive in person and sort of be heard, be seen, and interact. Certainly I talked about, advocacy. Advocacy is really built on like 1-to-1 or 1-to-2 or 1-to-3 relationship building. You can't do it really through Zoom. You have to do it through in-person communication, coming to a committee meeting, going to a hearing, just participating in an activity. And so, it's not just enough anymore to be a good physician, a good anesthesiologist in the operating room. We kind of have to spread our wings and just be everywhere we can. And, I always sort of ask everybody, that I work with, I said, find something or pick something that speaks to you, but just do something besides, being in the operating room, because we need you everywhere. And, that's really the only way I think we're ever going to effectuate change is sort of to amplify it one by one by one by one. So I think that's a really big component of it for me, looking at the younger generation. I think too is just to realize that, where we are today is going to be, the future is going to be very different from where we are today. And we're going to have to adapt, and we're going to have to continue to sort of adapt to these obstacles, to the challenges that our, specialty faces. The workforce shortage is going to make it a lot harder for us to sort of do those other things. But we just have to be innovative and continue to evolve and adapt. And the last most important thing is that, we're sitting here, representing the Latino Hispanic community, but, we can't do it alone with just 6%. We have to rely and build our group of allies, the people who see us, the people who hear us, the people who are going to, take us to the next level, because we need a critical mass, and the 6% is just not a critical mass. So I say reach out, raise your hand, knock on doors, and build your allyship, your ally group, because it's going to, I think, be key for the future. Jennifer, how about you?
Well, I think what I try to encourage the next generation, and they do quite well, but it is to be their true self and be their authentic self and bring to that to medicine. I think what you had said, Antonio, of that feeling of having to keep your head down and not speak out. Like we all sort of felt that. And we really all felt that we should just be lucky we're here, right? And so I think the next generation should be empowered to say there are inequities, there are problems with this system, and I want to be here in this place to change it. And Viviana, you're right, it's not a matter of just representing and being in the ORs, it's a matter of being at the table where the decisions are made, being in these leadership positions where you are in academic medicine and health systems and where you're driving that change. Those that are making the decisions, where the funds are going, what the programs to support, they're the ones that are going to make the real difference in understanding that. And absolutely agree. We need allyship, but we also need the students that are coming forward to feel like they can be empowered and be their true authentic self and not have to sort of hide or, kind of be the vision of what those in the upper hierarchy think we need to be, because we're bringing something, we're bringing ourselves. And I think all of us here have brought our true selves in what we do, and we're advocating. I am so impressed with the next generation. The students that I get to see that we recruit to med school, they're amazing, and they're going to do really wonderful things. We need to be able to help them, and get them to that next stage, because we have an opportunity to really make some real change and build that critical mass.
I love that. Thank you guys all for those answers and thoughts. Viviana, I wanted to hear your perspective about this.
I was very fortunate to be part of a class at UC Davis where 20% of my classmates out of a class of 100 were self-identified or identified by metrics as coming from an underrepresented background. And all of them were my close friends and still are. And so with regards to affirmative action, similar experience with UC Davis. There was a recent New York Times article that talks specifically about the UC Davis strategy and what they're doing to try to have a diverse class, but also to continue to identify other measures of disadvantage that are beyond ethnicity. And so I was privileged to be part of the admissions committee last year as well and go through many applications. I think I went through 150 or so applications, and it is a lot of work to screen and to individually look at all the different components of the application. But I do think it works, both because I have been a product of that system, but also because I participated in it. And I can say that I'm looking at things that are much more than the hard numbers and the grades and the MCAT and whatnot. I mean, by the time I was reviewing the application, there was a lot of background work that had been done and sort of categorizing and screening the application, so that by the time it came to me, I was actually reading a lot of personal statements and other aspects of the application that are very meaningful and that speak to the strengths of the applicant. And we called it distance travel, sort of the road traveled. It's a similar idea of what did you have to do to get to this point? And it gives you perspective, right? If you have somebody whose parents didn't graduate high school, whose home income is $40,000 for six, who went to community college, who had to work as they were going through undergrad. That gives you a perspective about the package versus somebody who didn't have to do any of those things, right? Because we're not comparing apples to apples, and we have to acknowledge that. And it's not to say that one is better than the other, but it's to say they bring different qualities, and it's important to have a representation of both of those groups in our classes. So I don't have much to comment specifically on the decision of removing affirmative action as a grander topic, but I would say that looking at ways to continue to improve the diversity of our school systems is critical. We know it. So for those who are wondering, well, how can I help? What can I do? This is one way to participate in that endeavor, because it is hours of work. So it is not easy to find people to voluntarily just do it. But getting involved is important. It is valuable work, and we can help. It's one way, one of the many ways that we can help.
Antonio?
Yeah, this question, really speaks to me on so many different levels, and I have such mixed emotions. So for me in particular, part of my path, at a very early age, I got identified as someone who was gifted in science and math, and being part of a public school system in Florida, started getting pulled into these kind of pathway programs, summer science foundation programs, even music programs. And I sort of learned through that process that, okay, you have to do this to get into a good college. You have to cross your T's, dot your I's, your applications kind of have to look like this. And, and then, I became a very successful student in a very, very, very large high school of I think the graduating class was 1,200. I graduated at the top of my class, and then I got into an Ivy League college, which I guess wasn't such a big surprise to me, but it was to everybody else, because no sooner than I got in, just about everybody in the school said, well, Tony Hernandez Conti got in because of affirmative action, and I was just like, what? What are you talking about? I'm the valedictorian of the high school, and I've done so many things. And, I think my merits speak for themselves. And so for me, the word affirmative action, it's sort of, it's a very loaded lightning rod type of word. And so, I think over the past, certainly 40, 50 years since I applied to college, the world has changed, and the world is smaller and it's more diverse. And we certainly have to look at things, I think, as Jennifer said, more holistically. It's the entire person's journey, their narrative, their obstacles, their barriers, what they've overcome, not just their race or the ethnicity, but a whole host of things. And so I think in some ways, I welcome it as a chance for us to reset and figure out a way forward. I'm part of the Kaiser Permanente School of Medicine. I'm a clinical professor there. And it's interesting because the school has just now started its 4th class. So it's a fairly new medical school. And so sometimes it's easier, I think, for medical schools or schools in general who don't have a history or a legacy or the status quo that they have to unravel to sort of start from scratch. And I'm really proud of Kaiser Permanente and the way they've approached it, because they really look at the entire person and their whole journey. And they are small classes. There's only 50 students in each class, but they are so diverse on so many different levels, geography, socioeconomic backgrounds, race, ethnicity, sexual orientation, gender identity. I mean, you name it, and the class is the most diverse sort of microcosm you've ever seen. The whole problem, with medicine is that medical schools are not sort of reflective of the population at large, or, as someone mentioned, how do you compare someone who goes to a 2-year community college, then transfers to UC or Cal State, and then how do medical schools evaluate that person, because they're not considered as, elite or highly desirable or prestigious or what have you. There's all these sort of biases that occur. How do you get rid of that? Now, I'll sort of quote an example. Texas, when affirmative action was struck down in Texas a number of years ago, the UT university system decided, the way we're going to undo it is that if you graduate in the top 10% of your class, across the state, no matter, how impoverished your school is, how disadvantaged or advantaged, the top 10% in every single high school is going to get in automatically to the University of Texas. Well, that sounds pretty good to me because it knows you have a chance. Like you have to just hit, there's 100 students in your class, you have to hit that top 10 and you get a ride to University of Texas. But with med school, it's really so difficult. But so I think right now we're sort of unraveling it. And so I don't really look at, the ruling on affirmative actions as necessarily a bad one. I think it gives us an opportunity to step back, reflect, and sort of chart a path forward. Where I do see problems sort of continuing to occur is after we arrive and after we become physicians. And here we are as Hispanic, Latino, Black physicians, people of color, LGBTQ physicians, is then how do we progress in the system and how do we get elevated and promoted and sort of reach those leadership positions? Because that's where it gets really, I think, sticky. And it's really easy to pigeonhole us and say, Jennifer Lucero will be great because she's Hispanic to be the director of EID. But you know what? She's also great and she should be the dean of the medical school, or, Dr. Conti should be the chair of a department or things like that. And so I sort of compare it to, like Hollywood tends to typecast certain people for leading roles. It's time to end that sort of typecasting, Latino, Latinas, Hispanics, Black persons, people of color, LGBTQ people. We need to be elevated everywhere. And, one of my main missions as the CSA president is to ensure that everyone's voice is heard, that everyone is seen, and everyone sort of gets elevated in whatever way they want to be. And everyone has a different journey. But I think the time has come now to make sure that we rise, because just getting through the door and getting our white coat and having the doctor, that's great. But then there's other steps that have to come with it. And that's the next part of the conversation, or that's part of the ongoing conversation that I think we really have to deal with, because those systemic barriers, at these very elite institutions and the obstacles, they are ingrained. They are really there. They're part of the brick and mortar of the system. And I think that's where we have to sort of raise our hands and say, why not? Like, why not us? So that's how I see it.
Bravo. I'm really inspired by everything that all three of you have said. And I actually am very hopeful that, people are each individually making a difference, and that people are going to get to those leadership roles that Viviana really wants people to get to. And I think about this phrasing a lot, you have to be at the table. So you're right, that is the goal. And I think what all of you are saying is it takes a very intentional effort, not just on, for example, the applicant, but the people who are quote unquote judging that applicant to make this happen, and to look at people on their merit rather than a certain test score or who they know. So this is all an elaborate way for me to get to my next question, which is allies, allyship, people who are going to recognize talent, whoever that talent is. So how can your allies help? How can the system help? What do you wish, our institutions, our departments, our perioperative divisions to be doing to help this cause? I'd like all of you to answer this.
I have a couple thoughts on that, and that actually to sort of add to what's already been said about the idea of how we define success and how we think about who's a leader, and I think allyship is both. It has to do with sponsorship, and it has to do with really redefining what is a successful leader on different metrics that we have actually used in the past. And I think we have this implicit bias. I think I like to think I'm hoping it's implicit and not, explicit, but how we define what leadership is in particular areas, what makes a good chair, what makes a great dean, or who deserves to be a CEO of a health system, what is that? What are those qualities? And there is intrinsic bias in what we look for and how we judge individuals. And we haven't broadened that. And I think we have to have allies there that sort of question what it is that, makes someone a great leader. And I've thought a lot about this because I look up and we've done some published some work on sort of looking at, when you look longitudinally, in a snapshot of who are the leaders, who are the chairs of departments in perioperative space and primary care space. We made progress a little bit in primary care, but really not in the perioperative space. And it's not because of the numbers aren't there. We always hear, just wait. It has nothing to do with that. It's how we're defining that. And we're defining it on a system that is really biased to really promote one certain group of individuals. And allies are the ones that are going to be the people that say, wait a minute, and the ally is the one that's, part of that community that's benefited to say, is this really what we need? Or maybe we should think differently about who gets to apply for this position. And I absolutely agree that someone from a marginalized community should not be said, okay, you're going to fit into this DEI space. If that's what they want, great, but they should be thought of in broader, aspects, because we all bring something different. We all have different experiences and we all have strengths, but how we define that, we've really defined it in a very limited space. And so I think allyship to me is really sponsorship, and it's also questioning the status quo, questioning the systems that have been set up that have allowed this, structures to continue with this hierarchy that we see, because we won't change it unless we do that. So those are my thoughts.
I would chime in and say that I have vivid memories of specific moments where an ally came into my life and not only pushed me to do something that I questioned if I was going to be good at, but individually contacted me and said, you will be great for this opportunity, apply. And sometimes I think that we have seen, or I personally have seen myself as a leader in my microcosm because of the spaces I've been able to occupy in my community, going through college and going to med school and being a doctor. I feel like in some way I have been a leader in that sense. But as we're coming into spaces where there is the majority group that are making those decisions, sometimes you need someone to identify or to help you recognize that you have qualities that are valuable and that you can also occupy those spaces. And so, being an early resident and have one of my senior attendings, an influential attending, say, you should apply for you should do this, embarked me in this trip of looking for more opportunities and recognizing that there's more that I can do, and others are seeing it, that maybe it is true. Maybe I am a leader. So in some ways, early on, when we're talking about early trainees, that's an example that I'm using, seeing us or seeing that group as, what are the opportunities that I can present them with, or where are the opportunities that I can say, so-and-so will be a great advocate or a great person to sit at this table. That to me is the idea of an ally. And eventually we all get into these positions where we can make decisions about who we bring to the conversation. And so to talk about the younger generation and say, we're going to bring this person, we're going to start having representation from the residents or the med students or the the earlier folks, is important. At CSA, we already do it, right? We have residents that write in our CSA Vital Times. We have them advocating. We have them coming to the meetings. So it starts early. And then, obviously, as we're moving forward and as we're talking about promotion, especially in the academic setting, is, how are you going to talk about those people at the tables they're not sitting yet? And how are you going to bring them into those conversations? And so there are the mentors that can guide you through the process of things that you might need to do. But certainly, and we know that most of our allies, just by sheer numbers, are not going to look like us and are not going to come from the backgrounds that we are. And so everybody has a role in it. It's not only the Latinx people helping the Latinx. It's like most of the people in power are not Latinx. So everybody has a role to help in that.
Yeah, and I'm going to just sort of echo some of the things that Jennifer and Viviana touched on. I think, first of all, allyship and mentorship and sponsorship, it has to be intentional. So there has to be a structure to it. And I'm pretty fortunate that I now work at Kaiser Permanente and SCPMG, where there is a structure for that. When we come in as associate physicians, we're part of a pathway to partnership program, and they sort of enlighten us as to what are the different, glide paths, what are the different opportunities within an 11,000 physician organization. But once you become a partner, then they have an emerging leaders program. A few years back, we did an inclusive climate assessment to sort of understand where the barriers were, what people felt was great about Permanente medicine, what was not so great. And one of the things that we identified was that there was sort of a lack of transparency in how leaders got selected, how they were cultivated and sponsored. And so as a result of that, the emerging leaders and the leadership programs became open to self-nominations. So you didn't feel like, or you didn't have to be part of an inside track or an inside clique, or if you felt like, no, I think I'm good enough because I'm good enough, that you could become part of this. And then when you're part of these structural programs, you then get exposed to leaders, at the division level, at the regional level, at even the state or national federation level, because you're doing projects and they start to get familiar with you, not only as a person, but what your work products look like. So I think structuralizing things, it's very complex. It takes a lot of time, but it's mostly intentional. When Jennifer talked about the way the medical school at David Geffen School of Medicine evaluates the med students, it's really intentional and it's very time consuming, but it has to be done. It has to be done because if not, it's sort of you're back at square one with, you're trying to overcome a barrier. You don't look or sound or whatever like them, and you're the odd person out in a system that just doesn't identify you, that doesn't see you as a leader because of these sort of implicit or explicit biases. So I think we have to do more. Was really happy that Viviana touched on the fact that at CSA we do sort of start early, and I think it's a big part of, I think what we do well is that CSA identifies residents who are interested in becoming part of organized medicine and advocates, but we also, try to take and provide resources and pathways for anesthesiologists at all career stages. Our committee on leadership development nominations, it sits down. If you want to, you have an hour-long meeting, and we really provide sort of recommendations, suggestions, things that you can do to get more involved, to sort of promote yourself within your medical center. If you want to track towards an academic career, these are things you might want to think about. But it is very structural and it is very intentional. And I think we just continue to do more of that. But all these things take time, they take resources, and we sort of have to keep, once again, I think, knocking at the door and making sure that, we ask for it. Because if we don't ask for it, it's not going to get done. And you do sort of have to call it out at some point. And I think we have to have what I like to call, a brutally fierce and honest conversation sometimes with people that, it's due, it's overdue. And, just to sort of, as we think about National Latina Physician Day on October 1st. I mean, part of this grassroots movement is that we're calling it out, finally, after all these years. It's like, okay, we know it. So now what? What are we going to do? It's time to change. So, thank you.
I love that. Thank you all so much. I wanted to summarize sort of the themes that I've heard during this conversation. And I would like each of you to actually just make sure that we leave the listener with what you felt like was something that you really wanted them to take away, from this conversation. But the themes that I heard during this conversation was, to each aspiring person out there wanting to, walk down this path, be true to yourself, and don't worry about how long it takes. Don't worry about trying to represent, do what you want to do, and that the journey is definitely worth it, and create that representation in the future. Be active, be seen, and develop allies. But if somebody is an ally, is a sponsor, be somebody that is not complacent, but rather questions the status quo, stirs it up, and changes the system. Because like you guys said, it requires a lot of intention and a lot of work to disrupt that. And it's much easier to just stick with the tried and true, but the tried and true isn't necessarily the best. So those were the things that I heard. And I really hope that the rest of us hear that, can take that away from this and create those action items for themselves. But that's me. I want all three of you to leave the audience with what you really want them to take away from this conversation. We'll start with Jennifer.
I mean, you really encapsulated all of it. I think every one of us had said the same sort of themes throughout it, but it was really impactful to hear our different journeys and really our experiences. I honestly, I don't have a whole lot to add to that, and I again want to thank you all for allowing me to sit with you and hear all of your stories and answer these amazing questions. And I'm just really feeling a lot more excited about the next 10 years and what we're going to be doing. And I'm excited to have you all here as my colleague and part of the CSA. So thank you.
Antonio?
I guess if I could say, kind of to encapsulate it, I think one is just to, be your own true, authentic self, and, be unabashedly so. Don't be ashamed of any part of you that's unique and different. Really own it, and, believe in yourself, even when others don't. Believe in yourself. But know that, none of us can do it alone. We've got to ask for help. We've got to, seek, friends and colleagues who are going to help us along the way, develop allies and sponsors, and just really be part of the solution. Come to the table and bring ideas and things that people can say, yeah, they're not just complaining. They're being part of the solution. They're bringing new ideas and they're trying to find ways to innovate. They want to make a change. We want to make a change. And so I think we should just own it. And, I think with today's social media and our technology, every single one of us can be so influential. I don't think we realize the power of it, that we are such powerful change agents. So just make it happen. And I really do appreciate Ludwig, you're taking the time to spend with us, and obviously the CSA and all of the work they do for all of our members, and most importantly, our patients too. Thanks.
Viviana.
I'm very thrilled and honored to have been here with you guys, both of you. I look up to the work you do, and I hope that I can continue to give back to the society and our patients at large. And if there's one thing I like to leave our audience with is when we talk about diversity and working to improve diversity, I hope most of us, all of us, I hope, have gone into medicine because we care about our patients and we want to we want our patients to do well and for them to have the best outcomes. And so when we talk about working on diversity or bringing a more diverse group of people and the importance of the work, it's not because it's a nice thing to do, but because it's a good thing for our patients. Our patients benefit from it. And like we talked about today, a lot of the people who are able to make the change that are sitting at the spaces where decisions are made, where perhaps they're less diverse than we would like them to be. It's not about the color of your skin or where you came from, but it's about that these things matter to you, and it's about sponsoring and elevating this topics and these conversations, right? Like the people that are able at this time to help us, our allies, are diverse themselves. They come from all walks of life. And this is work that we need to continue to do for our patients and for our society. So I love that we're having these conversations. I love that we're using this month to recognize the Hispanic heritage, but the work happens year round. And I hope we continue to do it.
Completely.
Thank you so much for having me here, guys.
I personally really wanted to have a diverse representation in terms of stage of one's career, but also the different types of practices, and to make sure we all understand, it's not about just one segment of the anesthesiologists. We are everywhere, and we're important everywhere, like you guys are saying. And also the other thing is, Viviana, you made a really good point, and Antonio just said this as well. It's about the patient care. It's about the patient outcomes, and we have data that we need to work on this. There is increased morbidity and mortality, and there's a reason for that. We need to have people taking care of these patients who understand the implications. Also, the other thing is, I didn't really get to say this, but there's so much talent in all of us, right? Why would we ignore a huge number of us and be missing out on that? I mean, that's the way I think about it.
Yeah.
Okay, I think we've done enough talking for today. Thank you all for being here. I'm so thrilled that we got to have this conversation. I really hope that we inspire some people out there. We're all reachable via social media, and I would encourage people to try to participate and to engage. And in conclusion, this is another episode of the Vital Times podcast series for the California Society of Anesthesiologists. And I'm Dr. Ludwig Lin. Thank you.